If you're thinking about being a registered nurse, there's something you need to think about before committing to this path. Nursing can be an incredibly rewarding career, don't get me wrong, but there are parts of the job and the time commitment and the long-term career opportunities that most people don't understand until they're fully in it already. I started my journey in nursing, but somewhere along the way, I realized that my goals were leading me somewhere different. So in this video, I'm going to be sharing the things that I wish I knew before I became a registered nurse and why I pivoted towards content creation now. By the end of this video, my promise to you is that you will be clear about whether nursing is for you or whether it's not, because I'm going to go over the things that I wish I knew before I started. So this is what nobody tells you, right? There is a gap between what you're actually told and what nursing actually is. Now let me explain. Nursing always has been talked about as a reputable career, has been talked about as something that's respectable, something that people look towards as a respectable career. When I tell people that I'm a nurse, typically they think, wow, that's awesome. You know, you choose to use your career to help people, and it's such an honorable role. And a lot of that is really true, but there's a caveat to that. Now, when you're in the hospital, things are very different. And so when I became a nurse, one of the first things that I realized was that patients may not always appreciate you. And I think this is like a given that when we go into a certain field where we're giving a lot of ourselves, where we're being very generous with our time, with our effort, that we expect a certain feedback from the patient, right? And that's just not the case. When you go into healthcare, there's a lot of entitlement. There's a lot of people that almost expect you to do what you need to do. And in some ways will even take advantage of you. And that's obviously not something that everyone will enjoy and be able to tolerate in healthcare. And it may surprise you, but the average bedside nurse actually leaves bedside within the first 2 to 3 years. And so realizing that and actually learning about that fact pretty early on in my career was really shocking, because I was very quick to kind of be observative about what were the things that drew a nurse away from the field. I was so curious about, why are nurses not choosing to stay? Isn't this an amazing career that pays really well? Like, what is it about nursing that is making so many people leave? And so I really took some time to think about this. And the more I work as an ICU nurse currently, which I'm still doing, the more I realize that a lot of those things are true about nursing. And sometimes you might not get that kind of compliment, sometimes you might have to have those difficult patients. The reason I chose nursing was very personal. I chose nursing because for me, my grandma actually passed away in a nursing home. And long story short, I always wanted to do something about it. And in the time that she passed away or was getting very sick, I wasn't able to do anything. And so for me to remember that moment and to go into nursing school was really for me to choose and take a step and an action towards making something right that didn't feel right in the past. It was for me to kind of redeem a certain part of my past that I hadn't been able to live up to my full potential. And so for me, every time I'm in the hospital, it feels like I'm caring for my great-grandmother, because I wasn't able to when she was sick. And now that I'm a nurse, that's something that I am able to serve out of, to provide care for people out of, because I do it out of the kindness of my own heart. Now, obviously not everyone goes into nursing for the same reason. Some people are trying to look for job stability, which nursing definitely provides. Some other people are looking for financial security. And all of those are really valid reasons, but a lot of those reasons may not be the ones that will keep you in the field for very long. And honestly, before I became a nurse, I imagined my life to be amazing. I imagined my life to be going to work and just enjoying taking care of people and just having the most fun learning about the human body, something that I was already fascinated in, and just getting to talk to patients, their families, and just feeling like the sense of fulfillment when I left work. And I honestly can't say that that's the entire truth. And I say that because of all the other things that I've talked about before, because there's just so many different moving factors and so many other areas of healthcare that make it very difficult for you to just like purely experience that part of healthcare that, you would go in expecting. So what people go into for the sake of helping people, for the sake of job stability, fulfillment, what they're actually walking into is this feeling of a lot of pressure, but they're feeling of, being less than, of not being able to meet certain criterias, certain, base, what's the word? Certain expectations, right? And so that's not the best thing. And I think that's why a lot of people leave nursing, is because it's difficult to handle all of that. It's difficult to hold all of that and miss being in a fulfilling career. I think something else I didn't realize was that nursing school really changes me. If you're watching this, you're probably or maybe in nursing school yourself, whether you're studying for an MSN or a BSN, and maybe you're already an RN and you're trying to become a BSN, or you have no idea what nursing is and you're just curious about it, right? I think that nursing school really taught me a lot of time management skills. It taught me how to, be able to study well. It taught me how the best ways that I was learning. And it also built this certain mental fortitude, mental toughness over the course of the classes, because you go through very difficult lessons and that's not easy. And I think it really shaped my personality and confidence in order to be confident in the hospital. And I think that in itself was a very transformative experience. Like, I don't take that for granted, and I really don't think that I would trade that for anything else in the world, because nursing school was such a big, impactful moment in my life. And I highly encourage anyone that's going into nursing or considering it to really think about it like that as well, because nursing is so much more than just the money and the outcome and the helping people, obviously, but it's the process of that. Something I talk about a lot on this channel is the journey being more important than the destination, because you spend so much time going to a certain place. That journey is equally, if not more important than actually getting there in the first place, right? And so being able to enjoy every step of the way, I feel like, is a very important thing that I held very close to me at going through nursing school, as well as even after nursing school into going into my first job. It was just such a helpful mindset shift to think that, this is part of the journey. I have to enjoy this part too. The other thing I realized is that clinicals are actually really eye-opening. So when you start nursing school, you'll usually get one day out of that week to do a 12-hour shift, what they call clinicals. And that's where you get to practice and really be in the hospital. That's what nursing school is really all about, in my opinion, is getting to experience and see, what unit you want to be on, what kind of things do you want to actually learn, what kind of things interest you. Do you want to work with kids, or do you like ICU better, or are you more of a peds person or an OB person, right? Like, or an L&D or an OR. There's so many different fields, like ER and ICU, like, right? There's I'm throwing things out there. But there's so many different areas in healthcare, which I feel like is itself like a really big benefit, because that allows you to have the freedom to experience and try a bunch of things, even if you don't like it. And I think clinicals is really good. It was one of my favorite parts of the week. It was pretty much, for me, it was like I saw it as, this is what I'm actually going to be doing. And so I took it very seriously. I took it in such a way that I viewed it as a way of like a practice role. Like, this is actually going to be what I'm going to be doing. And so it definitely was eye-opening for sure. Something that I think you should know if you're wanting to go into nursing is that it takes time to build confidence. And confidence will probably come a lot slower than you'd like. I think in nursing school, I'm sure if you're in nursing school, you experience this firsthand, but just being in this room of, other brilliant people that also study and work really hard and all want to get straight A's. Everyone is smart, and there's always this feeling like everyone else knows more than you. Like, when you're in a test, there's always this comparison game of, hey, what did you get? What did you get? I remember in my nursing school career, like, there was a lot of that. After we finished a test, everyone would leave the room to let, everyone else to finish and just focus. And one of the first questions you would always get asked is like, hey, how was the test? Like, what'd you get? And it's just like those kind of conversations, I feel like, that don't always perpetuate the healthiest environment, especially when it comes to nursing. I think there's a certain culture with it where, we all try really hard, which I think is an important thing. But at the same time, there's this certain comparison, there's a certain competitiveness that can be detrimental, I think, in terms of a field where teamwork and being able to develop camaraderie and helping each other is such a big part of the job. The next thing you should probably know is that nursing is probably going to have a big emotional weight on you. And this might not be, this might be pretty obvious to you because, depending on the unit you're in, if your patient passes on you, that's a very big deal, especially when your first patient ever passes away. You feel a certain attachment to them, and you'll know what I mean when you get there. And even if you don't, take my word for it, it's going to be a roller coaster emotionally. And I don't consider myself to be an emotional person, but there are times when I do feel like a certain weight of the family, the pain, the hurt. And you have to understand, like, these people are sick. These people are in situations that they don't want to be in, that they got themselves in, maybe because of bad decisions, and there's regret, and there's, so much family conflict, and there's things going on beyond what you can see. And a lot of times it's important to remember that, because you're not always going to be the savior in any situation, right? I think oftentimes we come into, at least for myself, coming into a situation with this certain savior complex, and we think that we are the ones that are going to be the ones to save this person's lives, literally, right? As a nurse. And as much as that is like somewhat true, I think a part of that is, out of humility, realizing that you are there to help them, and you're there to be a support, and you're there to be all the things that a nurse is: educator, helper, prayer, supporter, healer. But at the midst of it, like, a lot of it and some of it is not going to be, it's going to be out of your control. And I hated that, because I hated that things, I think if you're like me, you love control and you love to have at least a say in certain aspects of your life. And when it came to nursing, this was something that I didn't realize. It's like, I have no control over whether this person like lives or doesn't, especially in the ICU. Excuse me. And I think that kind of pressure can weigh on you if you don't learn to manage it well, if you don't learn to take it seriously and have ways of outlets outside of work. And so I think that's something that's really important, that I would recommend anyone that's going into healthcare and nursing specifically, is just being sure that you are going into it for the right reasons, and realizing that that will also come with an emotional weight, and that's the price tag of being a nurse. And although I obviously think it's very well worth it, for other people that are more emotionally driven, maybe it's safe to consider a different field, or maybe it's safe to consider a certain unit with less deaths. And so I think that's an important thing to consider for sure if you're thinking about going into this field. The final thing is that I think your life will completely shift. And what I mean by that is your time, your view of the world, your perspectives will change. It's something I didn't really expect going into nursing. I knew my life would be different, obviously, but I didn't know how different it would be. I think going into nursing, I think you really have to know that you have to be willing to change, and be willing to be open to what it is that the hospital is going to bring, because you're going to encounter difficult situations. You're going to encounter a lot of moments where you're going to question your own life. And I really mean this as someone who works in the ICU. Is like, you see deaths, you see so many things happening, you see smokers, you see people with backgrounds of alcoholism and certain histories, and you see the outcome. Obviously, they're in the hospital, and it's not a great situation. And I've literally had patients tell me, right, the ones that are able to talk, they said, don't do what I did, choose to live this better life. And that just gives you chills sometimes. Like, that puts a certain feeling in your heart or in your head that, like, there is this certain weight to the decisions that you make. Whether you're 20 or you're 30, it doesn't matter. But having that kind of perspective in life is so invaluable. And I think this is one of the most biggest benefits of being a nurse, is that you get to be in the front line of the end of life a lot of the times. And as pessimistic as that sounds, I think it actually reminds you about the meaning of life. It reminds you about the importance of what it looks like to live every day like your last, the importance of what it's like to love on your families, to not let the moment waste away, to make the most of your time, to make the most of every moment so that you can live life happily. And if you were to leave, this earth tomorrow, like, would you be happy about that? And I think that's something that I consistently come across, consistently think about as someone who works in the ICU, because you just have a certain perspective of the world that not everyone shares. And it's so real to you because you actually get to see what it looks like when you don't choose to live a life that you want. And I think that really hit me hard. So how do you know if nursing's fit for you? As I was going through those points, if some of those things scare you, then definitely take the time to consider and reconsider whether nursing is the role that you want to do, and whether or not the emotional burdens and, having to build confidence slowly and talking to family members and having to deal with entitlement and facing work stress and understanding that your life will be changed because you're going to be around a lot of end of life. If that all sounds really scary to you, then one, I think that's a good thing, but two, definitely consider like if this is something that you're seriously up for. You got to be able to see some blood, you got to be able to see some needles. Those are like pretty much bare minimum things. And so definitely consider those things. In terms of people that I think would really be good in this field are people that I think critically think and critically care. I think those are the two biggest things that really matter in nursing. One, obviously you have to be smart and you have to be able to predict and know when something bad's going to happen and know what to do as a result of that. I think the other part that I often actually don't see enough of is critically care. And this applies not even just in the ICU, but I think in any nursing field, really in any career where you're dealing with people, is that you should care about that person. You shouldn't go into nursing if you're just there for the money and you don't care for the people, because you're going to burn out quick. And that money is only going to give you so much joy for so long. And it's a matter of time before you're one of the majority of nurses that leave the whole healthcare field, the bedside, in 2 to 3 years, right? And I don't want you to have to go through that, all of nursing school, all the pain, all the suffering of getting a degree just to only work for 2 to 3 years. Like, I don't think that's worth it. And so what I'm telling you here today, I think is really important, because it would save you years if you're watching this before you're going into nursing. I think it's important to consider all of those points and be really honest with yourself about each one. All right, so if this kind of nursing content really resonates with you, if you enjoy the real, genuine conversations that I have with you guys, definitely subscribe, hit that bell icon if you don't want to miss a video from me. I do drop videos weekly, if not more, and we're really trying to build this channel out. I think it's been really helpful for a lot of you guys, and so I will continue to do so. Now, if you are someone who is going into nursing for the money, I actually made a video right here breaking down exactly what I make in my first paycheck, as well as what I currently make, everything from new grads to base pay to differentials. And so check this video out if you're interested in that.